Yesterday, I walked into my office and it was an explosive situation. The office manager, the office director, uh, another individual, and the patient were in obviously a very intense conversation with insurance company. And just the energy that was there made it clear to me that this was not a pleasant situation. Uh, Unfortunately, it's relatively common in medicine these days. There are snags with insurance approval, and that can be life altering for people, and it sometimes damage their health. But the way it played out over the next hour plus was that I had exhausted the second level of appeal on this surgical case and was now being pushed to North Carolina to do another level of appeal. And this is a kind of healthcare problem that is clogging up the system with delays in healthcare. And as the previous administration in Washington said, and the current administration in Washington said, it's amazing they both agree. This is about where 30% of our health care dollars go. So I want to tell you a little bit more about this individual. This is a person who works in an office who's been dealing with upper back pain most of their adult life. They have had various diagnoses. His problem is a little hard to figure out, but he's had two previous surgeries in the area with limited results. And of course, he's been through 6 or 8 weeks of physical therapy a couple different times, a variety of medications, injections, weight loss, all the usual things. And yet his spinal alignment continues to deteriorate forward and forward and forward. And there are some known causes of this, but in his particular case, it isn't known. And so he's come to me looking for some type of relief, knowing that his two previous surgeries hadn't worked, and the surgeons that were seeing him and the doctors that were treating him before that were saying there's nothing else we can do. So I'm a smart guy, but I've been here for 30 years. And so because I've been here for 30 years, people send me cases where somebody else can't figure it out. And I'm trying to determine the source of his pain. And I've got some pretty good ideas, but I really just can't quite figure it out. So at the end of the day, I say, look, you just need the area to have a major reconstruction. And so that's where insurance just automatically said no. And I can understand that because these are expensive endeavors. And sometimes there are surgeries that are being done that aren't medically necessary. And since insurance is paying most of the bill, I think it's fair that they question why we're doing the surgery. What gets aggravating is when I have to talk to somebody overseas who cannot pronounce the words and they're making decisions about whether or not the healthcare is going to be delivered. That gets to be intolerable. But in this particular situation, I was talking to actually medical people and even a surgeon, which is fairly rare, to ask for insurance approval. And the physician reviewing said, look, I understand this case and you're probably right to do this, but it doesn't meet our guidelines. And, that's a real struggle. And I understand why there's guidelines, but as I told the reviewer, it's called a guideline because it's a guide, not an absolute barrier. And as another physician, you ought to be able to use your medical judgment and see, taking the entirety of all the medical records, that this is a exception to the guideline and you need to go ahead and approve the surgery. Well, that failed. And I personally have spent an hour plus on the phone with the insurance. And I would say my office staff has probably spent 5 hours of their time. And of course, all this is done without any remuneration. So it gets to be an expensive adventure to carry on these kinds of appeals. And what is really kind of hard, I think, for insurance people to see is how this affects human beings, to see the human side of taking that paper and saying, well, it doesn't meet these check guidelines. And let you in on a secret, that's actually how the first level appeal goes, is when I'm talking to somebody, again, many times overseas, they've got a piece of paper and they're checking down the various treatments that have been performed or the symptoms that have been performed. And the reason I know this is because I can hear them ask, what does this word mean? And how do you say it and whatnot? So anyway, but now that I'm talking to a more seasoned individual who understands the actual condition, I want them to understand that if this person doesn't have pain relief, something bad's going to happen. They're already at the point where all they do is go to work, come home, and lay down and try to get ready for the next day of work. And then after doing that for 5 days, take the weekend off to try to recoup so they can go to work on Monday. And that's fine and okay. But after about 6 months, that really begins to affect other areas of your life. It begins to affect how well you take care of yourself. Are you able to exercise? Some people start drinking because alcohol is a pretty good pain reliever. And there are all kinds of other substances out there. So particularly in young men, we see about a third of the population get involved in those kinds of problems. It also affects relationships, because if you're no fun day after day, night after night, week after week, you start to lose friends. It starts to stress marriages. And so that's one of the things I would hope that the reviewers, insurance companies could see is the human cost of these denials. And again, I understand the process. I don't think it should consume 30% of our healthcare dollars, but there is a human side. And as an aside to that, I'm active in our state legislature. I go to Washington once, twice a year. And one of the things that Texas has crafted is what's called the gold card law. And basically that says when insurance reviews your cases, and they do for all the cases, and that's fine. If you're one of those practitioners, one of those doctors who 90% or more of your cases are approved, then leave us alone. We know what we're doing. There's another section of medicine that probably needs closer scrutiny, but save the dollars in healthcare costs, and also save the human costs of delaying medical care and all the sequelae that go with that, and let us practice medicine. So Texas has adopted that. The insurance side is not so excited about that and basically claims they're exempt, but of interest, the feds have looked at that, and parts of it are going to be put into Medicare so that once again we can stop a lot of this back and forth and needless delay in time. Because again, as these things go on, patients miss work, and missing work means they use up their PTO, and then they also cause trouble for the organization they work for. So it's a mess. But at the end of the day, I'm praying that truth and science will prevail, and this individual will receive the medical care they need, because they truly have exhausted every other option available. And this problem has been going on for close to 5 years. And from what I can see, they're going to end up bankrupt or something else awful if they don't receive that care. Most of the time, I'm treating people who are in pain. And so that's pretty straightforward. We're going to do something to relieve your pain, whether it's medications, exercise, stretching. And what I often tell patients, look, you either got to change what you do, or I got to go in and change your anatomy. And it's a lot easier to change what you do than me change your anatomy, because it's got risks and things don't always work out, and it hurts to do all that. But a couple times in the last month, I guess because it's spring break, I'm seeing college athletes. And these are people who are young, 19, so they're still kind of invincible, but they're not. They're having real problems with their back or their hips. And two of them were born with congenital anomalies. That is, the bones didn't quite form correctly. And they've gone on through life with really no significant problem. But now that they're at a level higher in competition, they're putting more demand on their spine and more demand on their pelvis. And so things are starting to hurt. And 2 out of the 3 people come from humble beginnings. If they can't compete, they will lose their scholarships. And for 2 of the people, they won't have a higher education, or won't even probably be able to go on to technical school to learn a trade. So they've got to keep going. The problem is, what do I do with that? Because I know medically the right answer is, again, stop doing what you're doing, because it's easier for you to change that than for me to go in and change your anatomy and accept all the risks that go in with the surgery. Yet at the same time, telling them to stop is going to change the trajectory of their life, most likely. So it becomes a real dilemma, and becomes a real dilemma because it affects the whole family. So earlier this week, I had the patient along with both parents, along with a sibling. And this is clearly the hope of the family, to really kind of take the family to the next level. But I don't think it's going to work. There are things I can do to help them get along for another 2, 3 years, knowing that that's going to probably cause more trouble down the line. But is that trade off worth it, to be able to help a couple people further their careers and lives at the sacrifice of one person's congenital problem in their pelvis? So, that's the kind of thing I think about at night, and that's the kind of thing I pray about, and makes what I do for a living very palpable and very perceivable, because we all know it's going to change. The question is, which way is it going to go? And that's where I sometimes go for spiritual guidance. 3 times in the last 10 days, I've had the same line, and it's caught my attention because I'm thinking about this at night. And the question is, would you rather be dead or alive and paralyzed? And about an hour ago, I just had that same conversation with an older fellow. He's in the late 70s. He's walking with a cane, but his spine is clearly collapsing down. He's at the point where he's almost looking at the ground, and he's in horrible pain. And he's willing to lay down and, "Doc, do what you need to do. If I don't make it, I know where I'm going." And I understand that line of view, but his spouse just cannot tolerate that. And she is asking, well, what are the risks of doing this? And asking the risks is fair, but to ask it repeatedly and then to call the office an hour later and still want to go over the risks tells me she's not comfortable with it. And so at this office visit, I'm refereeing a fight basically between the husband and wife, because the husband wants out of the pain and wants his deformity improved and can tell his condition is going downhill, but she simply cannot stomach the fact that she may lose her 79-year-old husband, and how her life is going to change because of that. And I feel sorry for them, because that's a very difficult question, one that I could understand wrestling with. But the problem is, if his problem isn't addressed, he's surely to go paralyzed, which doesn't mean he dies. He just lays in bed for the rest of his life in diapers. And again, for her, that's acceptable. For him, that's not. And it really, it tears me up to kind of have to relay that news and to referee that fight. So one of the messages from all this is to be aggressive with medical problems and deformities, and have these problems addressed while your heart, lung, liver, and kidneys are all still in pretty good shape, as opposed to just kind of pushing it off down the road, because there becomes a point in time where the condition is either too advanced or the whole person doesn't have enough reserve to heal from the medical treatment, and then you've just got to suffer until the end. So please take care of yourself.